like nothing better than to be able to highlight this in an in-person tour, but given the current situation we're in, it's going to be a little easier to do this via a virtual tour and maybe save the live tour for later. We'll give people just a second to get logged in and maybe get settled, and then we'll start our tour. As I mentioned, my name is Dr. Joe McCormick, and I am from Marshfield, Wisconsin, and super excited to be practicing orthopedics here in my home state. And I've been here for 17 years, very excited to be able to open up this new facility again in Fox Crossing. A couple of things to highlight about the new facility. This is both an orthopedic and a rheumatologic clinic, and we also have access to an acute injury clinic. And so acute injuries can come in really with just walk-ins only, no appointment necessary. And they'll be greeted by our front desk staff and be able to be seen by an orthopedic surgeon, guaranteed. Those kinds of injuries typically include lacerations, sprains or strains, or even small fractures, and all the capabilities to treat those kinds of things are available right here in the clinic. In addition to orthopedic surgeons, and we have 10 of them that are on staff here in the office, we also have 4 practicing rheumatologists. Our rheumatology clinic is this way. Let's head over. Some common rheumatologic diseases that we treat include psoriatic arthritis, lupus, rheumatoid arthritis, or juvenile rheumatoid arthritis. And we have 13 infusion suites that are generally designed to keep patients comfortable with Wi-Fi access, with television and snacks, in a relatively comfortable environment to make the treatment that much easier to tolerate. And to make it so that it's easy enough to get that treatment and get better. And again, we have 13 suites and 4 rheumatology doctors on staff here. Follow me and I'll head over to the orthopedic clinic. If we have any questions while the tour is going on, it would be okay to go ahead and type them in the chat. And we'll try to answer questions as we go.
We do have one question, Dr. McCormick. What is OSMS doing to keep everybody safe during the COVID-19 pandemic here?
That's a great question. So in general, what we do is screen for both patients and staff that include questionnaires and temperatures. And then we require masks to be worn during the stay here at the clinic and frequent wipe downs and extra cleaning between patients that are seen. And that's one of the ways that we're able to keep safe throughout throughout both the clinic visit and when you're around us for imaging and other things. Our orthopedic hallways, we have 6 different hallways that we work out of. But that also includes a minor procedure room where we can complete smaller procedure like trigger finger or carpal tunnel surgeries right here on day. All of the clinic rooms include a cast room and many different rooms for seeing patients. And then in between each of our actual hallways, we have an x-ray suite, and that's useful for being able to shoot x-rays on day, specialized views of films or extra films that need to be taken to help us treat patients. The idea with our treatment hallways is to keep things as efficient as possible, use the available technology for even specialized weight-bearing views or other kinds of x-rays that need to be taken in order to provide personalized treatment for each of our patients. And then let me take you down to our procedure room. So we do have the ability to accommodate some minor procedures by simply walk-in variety, where patients can come into the prep area and then come on over for a minor procedure to get that completed comfortably in a safe manner with the dressing placed and then be able to get that done sort of on day. The idea is to keep it fairly efficient in nature, keep it low cost, but also keep it convenient for our patients and have good outcomes as well.
Dr. McCormick, what kind of conditions do you treat in a procedure room?
Well, in general, some smaller procedures like injections or trigger finger, carpal tunnel can be easy to treat there. But we also have smaller things like taking out a foreign body or splinters, things that need a small exploration are easy enough to treat. In addition to the normal cast rooms, clinic rooms, x-ray suites, we do have some advanced imaging, and that includes MRI. And the MRI suite is located just off of the lobby this direction. Again, the ability to have the MRI placed here in the clinic means that a lot of times we can accommodate an on-day request for that kind of imaging and keep it convenient for patients and families. So again, that's a good portion of the physical portion of this first floor in our clinic. And we're super excited to open it and very happy to be able to accommodate patients already. In addition to this initial opening that includes our clinic portions and some advanced imaging, the surgery center upstairs will be open coming around November of this year. And that'll accommodate most small orthopedic procedures, and even at times we'll be able to move up to some same-day joint replacement surgeries. Therapy will also be opened later in a staged fashion, and that'll also be located upstairs, and that sort of completes the puzzle to be able to provide that musculoskeletal care from start to finish, all at one facility in a convenient location. Are there any other questions that we have at this point?
One of our viewers is asking if they have to wear a mask during physical therapy.
So what's been happening in general is that mask wearing in public buildings is generally required, but that at some locations when a private session can be arranged just with the physical therapist, and that always includes with frequent cleaning and wipe downs, in those situations, sometimes the mask doesn't have to be worn just in that one-on-one with the therapist.
Another viewer is asking if you do knee scopes in the office.
So once the Orthopedic Surgery Center of the Fox Valley is open upstairs, and again that time frame is around November of this year, it would be very common for us to perform knee scopes, knee arthroscopy, shoulder, elbow, ankle arthroscopy, which would be minimally invasive orthopedic surgery upstairs as a same-day surgery.
A few people are also wondering if they need a referral to come see us at OSMS.
So that's another great question. In general, a referral is required to see a rheumatologist, but a lot of times for orthopedic surgery, that's not necessarily required. And so it's always good to call. We have a fully functioning business office that can help with those questions to look at your insurance situation and find out what sorts of referrals or paperwork need to be completed before you're seen by a doctor.
What hospitals will you be performing surgeries at?
So the partnership with OSMS here in the Fox Valley is generally aligned with St. Elizabeth Hospital or Ascension here in this part of Wisconsin. So the majority of our 10 surgeons that work here also perform some level of service at St. Elizabeth Hospital as well.
Some viewers are wondering if OSMS accepts their insurance plans.
So again, that's another great question because we all need to know all the details of our insurance plan, but typically we're simply given the plan by our employer when we're there. You can either check that in the packet of information you were given, or again, the full business staff at OSMS will help to be able to look up that kind of information to find out if you can be seen here in our clinic.
Do you need to be a surgical candidate to see an orthopedic surgeon?
Orthopedic surgeons are generally trained as musculoskeletal specialists, and yes, are adept at certain kinds of procedures and surgeries, but also perform other small minor manipulations around joints, injections around joints, castings for minor fractures, and do other in-office procedures or non-surgical treatments that are possibly available.
What types of arthritis do you treat, and what are some treatment options?
So in general, the more common arthritis problems that we see involve our weight-bearing joints that include knees and hips and ankles, but also sometimes shoulder, elbow, wrist and hand problems. And for a variety of reasons, there's different treatments that can be used, sometimes bracing or injections or physical therapy, sometimes certain kinds of creams or lotions or certain kind of oral medications can be used. For certain, again, rheumatologic diseases, because the diseases affect the internal workings of the joint, there could be infusions of kinds that can be used, and those are amongst our rheumatology specialists help with that. And then for other things, we do have joint replacements or even joint arthroscopy that can help with pain or help with disability. The point is generally to try to get you back to as active as you can be.
How soon after surgery can I return to normal activities such as driving?
That's a really good question. We talk about return to driving all the time in an orthopedic clinic just because that's one of those tasks that keeps us independent and able to feel like we get back to most of the things that we can do. Individually, it's kind of hard to decide how quickly you can be back, whether it be 2 weeks to 3 weeks or even 4 weeks. And that sort of depends on the function of the legs or function of your seated posture or your shoulder or hands, depending on what kind of surgery that you had. Usually it's around somewhere in the 3 to 6 week range to be able to back to fairly reasonable activities. But most people, if they're trying to get back to their full active selves, take beyond that 6 weeks to continue to grow their strength, their balance, their confidence, and that full ability to return to activities that they love to do.
What are some of the most common conditions and injuries that you see here?
Well, any orthopedic surgeon generally sees things like sprains and strains, as well as broken bones, fractures, and sometimes things that require surgery. In general, all of that falls under the coverage of an orthopedic surgeon, but so does dislocations or joint laxity, problems where there's a joint pain but something's just not put together right, deformities, sometimes involving just children or sometimes something you were just born with, and other times there are things that develop as you get older. And so all of those things really fall under the work of an orthopedic surgeon.
What are the hours for the walk-in acute injury clinic?
So generally we're open right away at 8 o'clock, and we're open to see patients straight up till 5, simply on a first come, first served basis, and that's walk-in only. And that really is a nice service, something that's kind of unique to be able to be seen by an orthopedic surgeon right when you need it. Again, the clinic, as I mentioned and showed, has a lot of options for the beginning of the imaging that might be needed, to put on a cast or be fitted with a brace, or starting on a treatment plan that might even involve physical therapy. All of that can be accommodated at a simple walk-in visit.
All right, it looks like we don't have any more questions, so we can wrap it up here.
Well, I just want to say thanks a lot for joining me for today. It's really been a pleasure to be able to show you everything that we've got in our clinic and talk about some of the things that we're able to treat, both for our rheumatology doctors and orthopedic surgeons here at this facility. We're so excited to have it open and so excited to watch things grow and see you hopefully at this clinic if you need our help. Have a great night.